Hi, everyone. I'm Elisa Sherman. I'm the CEO of Ellementa, and this is our Wellness Wednesday webinar. Every month on a Wednesday evening, we invite an expert to talk about cannabis. And it just so happens that's our topic tonight. I wanted to let you know that you can find out about all of our different Wednesday and Sunday events at ellementa.com/events. And without further ado, I mean, we like to get right to it. This is Dr. Bridget. She is our expert today. We'll talk more about her in a minute, but hi, Dr. Bridget.
Hi, how are you? I'm excited to be here. Thank you.
It's really nice to have you from Columbus, Ohio, right?
Yes, yes.
All right. So what happens next is we're going to turn off our video and start the slideshow right away. There's going to be a couple of slides where I explain what it is that we do. Then I'll give you a little bit of an intro on the endocannabinoid system, and then we will go right into the presentation. Like I said, we try to get to the good stuff right away. So here we go. We're turning off our video. I think, there we go. Erica's going to take care of that. And let's see, I've got a couple of things that I need to click on to bring up our slideshow. And there we are. All right. This is a presentation of Ellementa. It is a global women's wellness company. And our topic today is pain and anxiety, treating your whole self with cannabis. And this is a topic that Dr. Bridget proposed, and I really liked the sound of it. We've talked about pain and cannabis. We've talked about anxiety and cannabis, but she said, you know, pain and anxiety, there's a lot of connection there, and she's going to explain more soon. Our goals today are to empower you with better information about cannabis for health and wellness, and to introduce you to what we do at Ellementa. So here's one of the things we do. We hold events. Typically, these are in-person events, usually 20 to 30 of them happening each month in cities across North America, but we're in an unusual time, and all of our events now are entirely online. So again, ellementa.com/events. We hold them on Wednesdays and Sundays, typically around 12 noon Pacific, 3 p.m. Eastern Standard Time. But again, this is the special monthly Wellness Wednesday evening webinar. The next thing that we do besides events, which are educational, is that we review products. We try products ourselves, and we let you know how they work. We're very careful about the companies we work with, the products we recommend. We like to see the ingredients that are in them. We like to see that they have some kind of testing so we know what's in them. If it is cannabis with THC in a legal state, then they have testing that's mandated. But if it's CBD, it's not mandated. We like to find the CBD companies who also test. So if you go to ellementa.com/reviews, you can see some of the products that we've been trying, and hopefully some of those may be helpful to you. The other thing I wanted to make sure I mention is that we have a book out. It's called Cannabis and CBD for Health and Wellness. Imagine that. And this book is co-authored by myself and Dr. June Chin. It was really amazing to be able to write a book with a physician who has practiced cannabis medicine for over 15 years. And she practices in New York City now. She was in California. It is one of those books that you can really look at anytime you need the basic information about how to use cannabis or CBD for a myriad of health and wellness related issues. Now, we'll do an interactive portion here. I want to know a little bit more about you. It's a simple poll. It's basically, which one are you experiencing? Are you experiencing pain right now? Or are you experiencing anxiety? It's possible you might be experiencing both. Or maybe not at all. You're just curious. Maybe you have somebody that you know and love who, oops, there's no poll popping up. Oh, there it goes. It's the magic of Erica. Thanks, Erica. So if you're not experiencing either one at this time, that's an option as well for you to choose. So right now, we'll just give a moment or two for you to actually click on the poll so we know. Now, some of you might be just researching for somebody else, and maybe they're suffering from anxiety or pain, or both. So it'll be interesting to see. Now, we can't vote on our end, but I would say for myself, I do have chronic pain. I have arthritis in my neck. My shoulders are a little wonky, and my left hip, yikes. I think it's probably arthritis as well. And anxiety, my anxiety, I don't think is related to my pain. I think it's more related to the times. And look, it's pretty evenly split between a lot of that. All right. Well, we are here to talk about all of those things. So let me introduce you more formally to Dr. Bridget Williams. Dr. Bridget, could you take a moment and give us some of your background?
Sure. So my name is Dr. Bridget Williams. I am the owner of Green Harvest Health, which is the only medical cannabis and life coaching office in Ohio. So I was with the clinic for nearly 20 years, and through my experience with patients and my own frustrations that for every patient there was a pill, I wanted to empower patients more and wanted to have more opportunities to find new ways of helping patients. Long story short, I eventually came around to cannabis and then realized my best way of helping them was with becoming a life coach as well. And so we have been open and running for the almost two years now. And along the way, we also developed our own line of CBD products that are well tested, mainly because early on we had some patients that came to us and said CBD didn't work and what they had looked strange. And it was olive oil and caffeine. And I do recommend CBD a lot. And so we started working with some cultivators to develop a line that reflects our patients. So we're very excited to have met people that were willing to have our input into the products that we've created. And now, besides my office, I teach at the Cleveland School of Cannabis, and I'm excited to be here today.
Oh, excellent. Well, we're excited to have you. I always love speaking with physicians, with doctors, with naturopaths. A lot of us hear from other kinds of experts, but to hear from medical experts is really comforting. Yeah. So the next thing I want to do is I've got a couple of slides which will help set the stage for any of you who might be new to cannabis and understanding why cannabis works for our bodies and our brains. It has to do with our endocannabinoid system. Endo meaning inside the body, cannabinoid, yes, it's named after cannabis. This system was more recently discovered than all the other systems we know about: our digestive system, respiratory system, reproductive system, nervous system. We've learned about those systems in science class, but the endocannabinoid system was really not discovered until researchers were trying to figure out why cannabis affects us the way it does, and discovered this additional system that lays over all of our other systems like a constellation of receptors. Cannabis has chemical compounds in the plant that then can either bind or somehow affect these receptors and affect each other. So it's a very fluid and dynamic process. You can think of some of these compounds as keys as locks. Keys that unlock the compounds, keys that unlock the receptors. So these receptors that we know about and that we have the most research on are called CB1 and CB2. And they're like the locks. So the receptors are the locks. I can't believe I confuse that part. I say this stuff all the time. The receptors are the locks, and the chemical compounds in cannabis are the keys. And speaking of the chemical compounds, the two most prevalent are cannabinoids and terpenes. So cannabinoids are the plant-based cannabinoids, the plant-based molecules, phyto meaning plant. And the most popular one that we hear of all the time is THC, and now the even more popular one, CBD. But there's a lot of others, CBN, CBG, and then variations like THCV, the acid forms, THCA, a lot of different cannabinoids, over 100 of them in the cannabis plant. So I like to call the cannabis plant a super plant, sort of like a superfood, because it is so rich in cannabinoids. Then there are terpenes. So terpenes are in a lot of the things we already eat. They're in plants, fruits, vegetables. You see the picture here on the screen. The conifers have pinene, beta pinene. That's also in cannabis. Citrus fruit has limonene, also in cannabis. Lavender, which is one of my favorites, has linalool. The terpene is called linalool. That's also in cannabis. And mango has myrcene, also found in cannabis. So you can see this plant, the cannabis plant, is so rich in chemical compounds. And cannabis also contains flavonoids. So it's just an amazing plant. And I'm now going to turn it over because I hope that just sets the stage for why we talk about the cannabis plant. But it is time for us to hear from Dr. Bridget. Take it away.
Absolutely. Yes. So in speaking about pain and anxiety today, unfortunately, pain is a huge part of the human experience. It touches on all socioeconomic levels, all ages, all races, and all life experiences. So no one is immune to pain, unfortunately. More than 30% of Americans are living with some form of chronic or severe pain. And more people live with chronic pain than cancer, heart disease, and diabetes combined. In our own practice, we do survey research, and 65 of our patients that come in for medical cannabis treatment or to receive a card, 65% of them come in for chronic pain. So you can go to the next slide. Okay. So I want you to remember this particular chart here, or this image, because this is really the foundation of what we're going to talk about today. That there is the natural behavior of pain, which we're quite accustomed. You stub your toe, you have an injury, the neurons go to your brain and tell you you have pain going on, and with treatment it will resolve. And then there's the more ongoing, longer pain, which we're going to discuss quite a bit more today. And then as that goes on, and we'll talk about the details, you actually start to develop a new pathway. And that new pathway is actually more intense than the original pathway itself, and actually causes a vicious cycle. So if you keep this in mind, you know, give yourself a little photographic memory there, and we're really going to talk about this over and over again. So you can go on to the next slide. So pain and anxiety are more closely related than we might think. It is the center of what becomes the chronic pain syndrome that develops in about 25% of chronic pain sufferers. Chronic pain has consistently been the most common patient-reported qualifying condition for medical cannabis, which is about 60%. Like I said, in our practice, we found it was 65%. And so 60% overall come in for chronic pain for medical cannabis diagnosis. And this was in a study in February of 2019. So go on to the next slide, please. So typically, with acute pain, a person experiences an injury. Remember the image I showed you, and those signals are sent to the brain to warn you of harm and injury. with time, possibly with medication or therapy, whether it be physical therapy, Tylenol, anti-inflammatories, what have you, the pain typically resolves. Next slide. So chronic pain develops when pain continues for more than 3 or 6 months. The nervous system continues to fire the signals of pain for weeks and months, even years. This can occur with a simple injury such as a sprained ankle or back strain, or an ongoing pain such as arthritis or headaches or cancer pain, even fibromyalgia. And sometimes we do not know the identifiable injury that started the cycle. Typically, very little works to control this type of pain. Whether it is a nociceptive, inflammatory, or neuropathic pain, meaning the nociceptive is more of the tissue damage, injury that is the most common type of pain that we all experience. The inflammatory is that response where you have more swelling and redness, and there's a pain cycle that occurs with that in itself. And of course, the neuropathic is where there's more damage to the actual nerves. And when this becomes involved, there are multiple components to this, not just the feeling of pain, but there's sensory, there's emotional, cognitive, and behavioral elements to pain. So when chronic pain causes a secondary complication, this is when it becomes chronic pain syndrome. Chronic pain syndrome develops when a chronic pain sufferer starts to have difficulty sleeping, and the lack of rest creates irritability. The ongoing pain becomes more difficult to handle and often leads to the person no longer able to do their job, leading to financial issues, which leads to difficulty sleeping again. This vicious cycle disrupts relationships with loved ones, self-esteem, and leads to a feeling of a lack of control, and of course, then anxiety.
Ooh, I want to jump in here for a
Please.
minute. Yeah, and it's the first time I've heard about chronic pain syndrome, but I know now that that is what I was suffering and what actually led me to cannabis in the first place. I had arthritis in my neck after having suffered over the course of 5 years. I had 2 frozen shoulders, which if anyone has had frozen shoulders knows that it is excruciating pain and you cannot move your arms. But then after my shoulders were doing fine, my neck kicked in the pain and I couldn't sleep because of the pain. And then, like you said, it became this vicious cycle. I couldn't sleep. I was exhausted. I was irritable. The quality of my life was just plummeting. My relationships were getting so stressed because of that pain in my neck. And my husband kept saying, well, take a bunch of Advil because you need to break the cycle of pain. But even Advil wasn't helping. And that's when I eventually heard about cannabis as medicine, which was wildly different than anything I had heard of before. And it took me a long time of resisting and fearing it before I actually tried it. And when I did, and I know you're going to talk about that in a minute, but when I finally did try it, the relief was almost instantaneous, and the ability to sleep was phenomenal. It was literally like night and day. I suddenly slept through the night for the first time in over a year. And yeah, that was a real big revelation. So
absolutely.
I appreciate you talking about this because you could be in it and nobody tells you you're in it, and you don't understand that this is actually a common thing. I mean, 25% of pain sufferers, that's still pretty big.
Yeah, absolutely. And what we've realized is that if you're not aware of it, and I think almost more importantly, if the medical community is not aware of it, then we're continuing the same cycle of using anti-inflammatory, narcotics, pain medications, and we're not getting to the heart of what the true problem is. If you can get to all of the components, you're more likely to be successful. And that's where really cannabis comes in, as you noted there.
Yeah, where were you 3 or 4 years ago
Yeah,
when
yeah,
I was in this cycle and nobody would say anything and they all wanted
right.
to prescribe painkillers
Mhm.
and I'm so super against them. So I just suffered in
Yeah,
silence
and they keep
till I said that.
continually increasing the doses as you go along,
Mm,
thinking if we increase the
mm,
dose, maybe it'll kick in. And
yeah,
yeah, that's not how it ends up happening. So
yeah,
yeah,
that's not good. All right,
yeah.
next slide here.
So let's use the example of cancer-related pain. And so roughly 40% of people with a cancer-related pain report experiencing psychological distress that often takes the shape of excessive worry or panic attacks. People with chronic pain are 3 times more likely to develop symptoms of anxiety. So that's a big, big part of this.
Mm. You know, you also in your notes, you had mentioned something about guilt as
Yes.
another
Yeah.
component. I mean, this is really multi-layered
Hmm.
in terms of the kinds of emotions that you could experience because I did feel guilty about my pain. I
Hmm.
felt helpless and incapable. And then when I would lash out at my family members, I felt a tremendous amount of guilt, but I couldn't help it.
Right.
It was really
Because
out of my control.
guilt is really a form of anxiety, right?
Mm,
And the pain can literally change your personality over time.
hmm.
And
It did.
yeah, and then people don't know how to respond to that. They don't understand what's going on either. So absolutely.
Hmm. Yeah.
So the anticipatory pain. So this kind of goes back to that image that I showed you initially, and the cycle of the anticipatory pain that your body is preparing and warning you of the pain before it even happens. And it's a psychological strain as it causes, and it is completely underestimated and undertreated. The signaling of the anticipation of pain is often stronger than the original pain and more difficult to treat. Consider a patient that has lost mobility. This leads to concerns about safety, about engaging in sexual intimacy, may also be a concern which will intensify the anxiety and the fear. And as we were saying before, this can also present as guilt for patients. And in many cases, this often leads to alcohol and substance abuse, and of course, then depression. It's a very, very vicious cycle. Okay, next slide there. And some are more easily able to adapt to changes in their lives. So everyone doesn't experience this, right? That we say that there's about 25% that develop the chronic pain syndrome because some people adjust more easily, but there are a lot of people that become very overwhelmed, and that's when the anxiety and the struggle to cope really kicks in. So how do we address this? How do we treat this? So attempting to treat chronic pain without considering the psychological effects of the anxiety and other psychological effects is a reason that chronic pain is difficult to overcome. So in considering treatment for chronic pain, first consider the psychological effects as well. Anxiety and chronic pain can be treated with therapy, with medication, and alternative treatments such as acupuncture, CBD, and cannabis are effective where other pain medications have failed. Cannabis treats not only the pain, but the anticipation of the pain as well.
Interesting.
So looking at CBD, CBD has consistently been shown to address anxiety in numerous human and animal trials. Doses of about 20-1, meaning 20 parts CBD, 1 part THC for CBD is recommended. However, as high as 600 milligrams have been studied for panic disorders. And many times when you're looking at a lot of the scientific research, they're using pretty high doses for their studies. Our typical recommendation, mind you, for anxiety is about 30 to 50 milligrams. In treating pain, CBD has also been found to be highly effective in trials. CBD is an excellent, excellent anti-inflammatory as well. Dosage level is similar to the anxiety treatment. However, if pain is very intense, THC may be added for better pain management.
When you say 30 to 50 milligrams, is that a daily dose of CBD or each time you have that dose?
Well, typically we're starting with that one-time dose, but then
Mhm.
that can be repeated more than once a day. That can vary so greatly with patients, where
Sure.
particularly with CBD, if you're taking it regularly, sometimes you don't need as many multiple doses during the day. However, if you're taking it more sporadically, you might be needing multiple doses to reach that same effect.
Mm. Got it. Got it.
So with THC, THC may increase the anxiety in some patients, okay,
Mm.
but can lower anxiety symptoms in others. So you always have to be aware of where you fit in with that. It is recommended to use THC at lower doses for anxiety symptoms, about 1 to 3 milligrams. And CBD can reduce the anxiety that THC may produce. So
Mm.
having some, I always tell my patients, have a little CBD. If you're a THC person, always have some CBD around for a number of reasons, okay? Regarding pain, THC has the ability to make you focus less on the pain. It's not so much that you have this euphoric high, which for some are a welcome benefit, and for others, it's a cautious side effect. It's simply that the THC helps you focus less on the pain itself, and that makes it very effective. Some prefer a high THC strain for pain control, while others appreciate the benefits of a high CBD with some THC. We often recommend a 1-to-1 concentration for pain and inflammation. So without the euphoric effects, because CBD will block the high you get from the THC, and also including other cannabinoids can also be very effective for dealing with pain, including CBC, CBG, THCV, and THCA.
So the thing that I like to always emphasize,
Mhm.
and people who are less familiar with cannabis or CBD, and you sort of mentioned this already, having CBD on hand, if you are going to start taking THC and have not taken it before, aren't familiar with what your dose might be. And this is sort of the unusual thing about plant medicine is it's not necessarily one size fits all. It's very individual how your body will react to these chemical compounds. So if you take THC for the first time and you feel very uncomfortable, so it won't kill you. That's the
Mhm.
beauty of this, but it could make you feel really awful
Yes.
and uncomfortable and anxious, as you said. And
Mhm.
then the CBD on hand, taking an oil under your tongue, holding it under your tongue, can block that THC that is trying to bind to the receptors in your brain. It can just temper that and bring you down rather rapidly so you
Yes.
can be a lot more comfortable.
Absolutely. Yeah. Now we often, over with my students over at the Cleveland School of Cannabis, we often talk about the use of black peppercorns,
Mm,
where
yeah.
there's research that shows that the terpene, the beta carpholine, actually also binds to the CB2 receptor. And you can chew on a few black peppercorns, and like CBD, within about 15 or 20 minutes, you will start to get some clarity as well.
Mm.
So if you don't have CBD, then we recommend that. And I had a patient not that long ago who was going on an airplane flight, and she had a high dose THC gummy for nighttime and a very low dose for daytime. And she got them mixed up and
Uh-oh.
took 2 of the high dose THC and was on the flight and really literally thought she was going to die. And then after really self-talk for a while, she remembered the pepper advice, and she asked the airline assistant to bring over packets of black pepper, which I'm sure that in itself seems strange. And she was downing and sucking on this black pepper, but within about 20 minutes or so, things started to kind of clear up for her. So I
Mm.
thought that was a great use. It took her a minute to remember, but it was definitely helpful for her.
Yeah, yeah.
Absolutely.
Interesting.
So overall, I would recommend a balanced approach to chronic pain syndrome. Incorporate a balanced diet, rest, meditation, therapy, and possibly stress reducing exercise if possible. Yoga, Tai Chi, taking walks. Um, if you're not quite sure where to start with a full spectrum CBD. If possible, to incorporate other cannabinoids in there. If it does not reduce your anxiety and pain enough, incorporate THC, increasing the THC as needed to reach a therapeutic level. Also look for indica dominant strains that enhance the relaxation, aid in sleep, and also relieve pain.
I
Don't
wanted to
forget,
also,
yes,
yeah, I wanted to mention about the full spectrum CBD.
sure.
We always say, and we hear from every physician,
Mhm.
full spectrum CBD has more therapeutic value than
Mhm.
isolate. But
Yes.
some people, for various reasons, may only be able to obtain or only want to take an isolated form
Yes.
of
Mhm.
CBD, which would be called a CBD isolate.
Mhm.
And there is still efficacy, it can still be helpful, but with a little bit of THC, it really boosts the effectiveness of that CBD.
So I think that's interesting that you say that because I'm definitely the full spectrum person, and that's the perspective I take with this. We do have with our CBD we do have an isolate really for the person that may be fearful of THC, afraid of drug
Mm-hmm.
testing, even though you'd have to drink a gallon, but still, they want to stay clear of it, which is totally understandable. But that little less than 0.3% is can be significant in your therapeutic approach to whatever
Mm-hmm.
condition you're focusing on. So I've had people say, oh, well, it's 0%, but it's not really 0%. That small amount can still be effective, including the fact that with a full spectrum CBD, the other cannabinoids tend to be around that same level, and we consider that actually effective and useful as far as treating conditions.
Mm-hmm.
So don't, boo-hoo that 0.3%. That might be that little bit that you need to kind of even things out and help you.
Yep, exactly.
Absolutely. And so the last thing I was just going to mention was terpenes, which I always think so many people are interested in essential oils and aren't as familiar with cannabis. And I think I was more aware of terpenes and less about essential oils, and learning about both kind of can be very interesting and fun in itself. But remember, terpenes are important to boost the effects of cannabis, and the beta carotene and myrcene and linalool will enhance the pain treatment, where the limonene is an addition that provides calmness to the spirit and helps brighten your mood. So take all of that into consideration when you're looking to treat your pain and your anxiety.
One thing I learned from Dr. June Chin, my
Mhm.
co-author, is myrcene, while it can be very good, very sort of sedative,
Mhm.
relaxing, it is not necessarily recommended for menopausal women.
Mhm.
And I'm not quite sure all of that, but I felt it's important for us as women to understand that at every different stage of our lives and different hormone levels in those stages, that can affect how cannabis works or doesn't work for you.
Mhm.
And so just understanding that by going to the test results that we talked about, you could see if there's a lot of myrcene in something, you may want to avoid it if you're perimenopausal or menopausal.
Yeah, that's an excellent point. That those things change as we change, and
Hmm.
so yeah, that's an excellent point to bring up as well.
Since most of our audience tends to be female
Mhm.
and many of us are in those other years, I do like to bring that up.
Mhm.
Now it's time for questions. What we want to do at this point, I see a lot of discussion happening in the chat box and some questions waiting for us in the queue. At this stage, we come out of the slideshow. I
Mhm.
stop sharing the screen at the moment, and then we bring our videos back up. so that we can speak with you and answer your questions. Let's see. Erica, can you help Dr. Bridget bring her
Oops, I pushed the wrong button. Sorry.
video up? And let's see what's happening here. We have a lot of conversation in the chat. So I'll look in the chat right now. If Erica, do you want to, you're muted, but take a look in the Q&A.
I was muted. Okay.
You are muted. I'm going to look at the chat box while you're looking in the Q&A.
Yeah, there's a lot of questions that are just kind of this big, broad range. So this one is a question, will your body become addicted to cannabis?
So when we look at cannabis and dependency and addiction, that is a fear that a lot of people have. And the studies have shown that cannabis has the dependency level of caffeine. So basically, very similar to how you would like to have your coffee, but you're not going to die without your coffee, right? And it's your body doesn't become absolutely attached and dependent on it. So as far and it doesn't take very much for you to kind of move on beyond it. So when you're concerned about cannabis, can people have a poor relationship with it? Yes. Okay. Like some people have a poor relationship with shopping, right? And so sometimes people will misuse it, but that is not the same thing as addiction. So many times I think people confuse the two. But in reality, your dependency on caffeine is as difficult in your life as your caffeine and your morning coffee. So it's more of a habit than an addiction.
So I just want to mention somebody here, Dan said, some may choose isolate because of drug tests, which yeah, we mentioned, but he says people can still fail them with an isolate, or so he hears. We've always said, in order to be safe, if you are drug tested, having any kind of cannabis product could potentially show up. Isolate would be less probable, but we can't ever say definitively. The other thing is anything like that is CBD, because it's not mandated to be tested, it could have other things in it.
That's really the problem there, that because we're not completely covered by the FDA at this point, the testing might not always be truthful. There might not be any testing at all. And so you might think you have an isolate, and in reality, you might have something that has more THC than you were aware of. And so that's how you end up failing the test. That's probably the most common reason why that happens, is that there was just more THC in the product than the person was aware. Overall, CBD alone should not have you failing a drug test, but we can't always guarantee that because we don't always know what's in it.
Yeah. So we never say definitively, yes, you're totally safe.
Right.
That would not be responsible.
Right.
Oh, I always say, Erica, get the questions. And I'm like, oh, wait, hold on. There's another question. So Sarah asked, will you be addressing the use of CBD, CBG, CBM in children during this presentation? And I know you didn't specifically mention children or even adolescents. Sure. What is your take as a physician in terms of treating children or adolescents where it's legal and in a legal manner? What is your take on that?
So we're in Columbus, but I have actually a group of parents in Cincinnati that have children that have reactive disorder. They have autism, ADHD, and all of these families are actually using our full spectrum CBD for treating their children for different aspects of their condition, to have them work better in school and sleep better, what have you. They also do some other natural, like magnesium, some other things to kind of create some balance with the children. We've seen incredible success, and note that this is not a formal study. This is anecdotal from my practice. I've used CBD with, my own children at times. I think it can be helpful. Absolutely. I am still very much of the school where THC at too young of an age can be an issue, and only recommend that in the most severe cases of conditions. But starting with CBD, I think most of us are familiar with Charlotte Figge and seizures, and she started with basically almost like a high concentration of CBD, making it into an oil, and how effective it was for her, where there was a similar girl also, I believe in the Colorado, Denver area, that did not do as well, and she needed the THC for her seizure disorder. So in severe cases, THC might come into it. CBD, I feel pretty comfortable with.
That's good to know. Yeah, that's pretty much consistent with everything that I've heard. And basically the idea that the developing adolescent brain, and the brain is continuing to develop until about 25 years of age. So I even tell my kids, after 25, if you're living in a legal state, then it's your choice. But up until that point, that your developing brain, especially a healthy brain, does not need it. And a child's brain, unless they have certain conditions, is basically healthy. And so there's no need to do that. Let
me just kind of mention here why that's why would we be comfortable with that? And what CBD does is it's not adding a more chemical. It's not causing obviously the euphoric effect. It's actually making your endocannabinoid natural system and the cannabinoids that are in there just function a little bit better. Okay. So basically it is keeping your anandamide and your 2-AG in the synapse longer. And those endocannabinoids are already there. They're just making them work a little bit better and helping create a better balance. The CBD also can work with other receptors within our body. And that's how the endocannabinoid system is different, in the sense that it creates that homeostasis and balance by working with the receptors of other systems in our body. Okay. And so it's not that it's adding something to it. It's just making what's already there just function a little bit better.
Yeah, I call it nourishing the endocannabinoid system.
Yes,
boosting.
Absolutely. A little boost, right? Absolutely.
Yep. There's something else here, which is a good question about sleep. So Lori's saying it's overwhelming when trying to pick a particular item at the dispensary to help relieve pain so you can sleep. CBD products have not worked for Lori. Are there names of strains that you can speak to that would be good to use? Also for sleep, is smoking it better than gummies?
Yeah, that's kind of difficult in Ohio because smoking is strictly prohibited.
Right. So theoretically speaking.
Theoretically, right? So one thing of course, my first thought is, if you're having trouble sleeping and you're looking at flower or different products, indicas are a great place to start, right? When speaking about specifically strains, many times what we have here have a little bit of a different name than what you might have in other places. So that can get a little bit more difficult. But overall, what I try to teach my patients over time is, what is it that you're looking for? You might be looking for an indica that might be a lot more relaxing. You might notice that certain THC levels seem to be more effective for you than others. As well as you found that CBD was not effective for you. And then you might be looking for certain terpenes. And so I try to educate my patients to look for the linalool, to look for, if you kind of have an understanding, you're used to cannabis, you might be looking for a little bit more of a THC that you find comfortable and relaxing, and also looking for that indica. And if you put that together, then you are more likely to find a strain that could be effective for your sleep.
And that goes back to test results.
Yes, it goes back to test
legal
results.
States where they're selling cannabis flower, you can ask for the test results and see the chemical makeup and see which comes out higher, what percentages. Right. So that's super helpful. And then in terms of smoking versus gummies.
Let me add that CBN, which is actually the degrading THC. I don't know if that sounds very appealing, but but
I know what you mean.
Right. As THC tends to get older, that's how you develop CBN, which is one of the other, auxiliary cannabinoids, and that also is extremely helpful for sleep. So then going back to the test results, or some of our dispensaries will list a lot of this for you. So that makes it helpful. That can be really great. So if you're really having difficulty sleeping, look for the CBN, and there are definitely strains that will have more of those, more of that than others, and it just takes a little bit of research.
And it doesn't have to be old weed in order to have
not old. No, I don't recommend.
Right.
There's a whole nother conversation. Yeah.
I might have to have that conversation with you later. And the other piece of it, the gummies versus the smoking. So my understanding, and correct me if I'm wrong, that when you smoke, when you inhale, so that could also mean vaping, when you inhale cannabis, and it goes into the lungs, it is a much more rapid uptake. You feel the effects much more rapidly. Then they'd last not as long as when you have an edible. So when you have an edible, it takes longer to have the effect because it's got to go through digestive system and then out your liver. Coming out of your liver, it's more potent.
Yes.
And then it lasts longer. And that's why a lot of people have had those accidental, oh my gosh, too much edibles, too many
Every
brownies.
bad story with cannabis starts with, and then I had another. Every single last one of them.
So
if you're talking, So when it comes to sleep, and like you said, edibles versus smoking, I often recommend an edible because yes, it does take a little bit for it to kick in. But it's going to last for 6 to 8 hours. So if I have a patient that has trouble staying asleep in particular, I'm often going to recommend an edible. If I have a patient that simply just has problems falling asleep, but once they're asleep, they stay asleep, then inhaling might actually be a good option for them. So it really just depends on their condition. I'll tell you one thing that I've been doing quite more recently with my patients is that that sublingual effect where you're absorbing it underneath the tongue. I will have them take the gummy and actually hold it in their mouth for a little while and let that absorb for a little bit before actually chewing it. So you get a little bit of that more immediate effect while it is absorbing underneath the tongue, but then obviously all of it isn't going to absorb, and then to allow the rest to go through the first pass metabolism and through the liver. And that's going to take a little bit longer, but you can get some of that benefit a little bit sooner.
So, and I just have to mention on a personal level, when I was in that cycle of pain and I learned about vaping cannabis, and just a few puffs would help me feel sleepy so I could go to sleep. But then I would also take an edible because my biggest problem was waking up in the middle of the night.
Right.
And with that combination, when I was in the thick of that pain, it was extremely effective. And so I can't remember the term for that. I call it layering. So you have your immediate effect, and then you take something else that has the longer term effect. And then that, just being really conscious of the fact that you're doubling up in a sense, but it does last a lot longer.
Yeah, absolutely. You have one that's getting ready to start working while the other one already started. So absolutely. Sounds great.
Erica, I'm gonna turn it over to you. I still see a lot more questions in the chat box, but do you have anything else in Q&A that needs to be addressed? If not, I've got a few more over here.
You know, there's actually one in the chat box that I think is a fantastic question for this topic. Is Drew is asking to speak to those who have been prescribed Xanax for anxiety. Many who have had cancer or have cancer have been prescribed. Is cannabis a better alternative?
You were on the same one I was on.
Yeah,
very good. So for many, yes, right? So of course we can't speak across the board for everyone, but I definitely have many patients where we start pulling away from the Xanax and that they're actually able to use, for some, they actually get some relief from the CBD by itself. And then for others, a little bit more THC, and they can avoid the Xanax altogether. We actually, with our research, we actually found that 46% of our patients either stopped or decreased some of their pharmaceutical medications since beginning in the medical cannabis program. So we end up working with patients to identify the medications that they do want to pull away from, and then helping them make medical cannabis CBD options and slowly weaning away from their medication and finding that right dosage to use cannabis instead.
And I want to also just caution people that
Mm-hmm.
Don't stop your medication on your
Right.
own
Right.
and
Yeah.
think that cannabis is going to be the solution. And the second
Mhm.
piece is be very honest with your physician if you are looking at or taking cannabis and CBD, because the medications they prescribe, there are sometimes contraindications, is that the
Right.
technical term, or just things,
Drug interactions.
drug interaction. So it is a medicine. It is,
Yes.
in a sense, a natural medicine, but it is going to potentially interact with other medications that you're taking.
So we try to work very directly with physicians, other physicians. Like, I'm a family doctor by trade, and so we try to pull all that information together. But we've had incidences where, particularly with pain management, where as soon as they find out that the patient's on medical cannabis, they do not do a proper wean, but just stop. And that's never really the great approach for this. You really want to wean away as you're developing the right dosages of your cannabis. Then you start pulling away from the dosages of your other medications, and it should be a very slow process.
Yeah, good point. Oh, somebody is saying that chocolates work faster for most than gummies. And that would make sense because the chocolate can dissolve a lot faster. It melts in your mouth. It can dissolve a lot faster. The gummy is a little bit more of a solid.
Yes.
The other thing I had learned, so I've tried a lot of the CBD gummies in particular for review purposes. And we don't review something if we really don't like it. And I have to say, so many of the CBD gummies actually don't taste very good because the process that they use is almost like just spraying the CBD on the outside, and it's very chemically.
Yeah.
So there's very few gummies that are CBD that actually taste good. And I did find one. I'm just going to give them a plug only because they're phenomenal, and they did not pay me to say this. It's called Pollen, P-O-L-L-E-M. It is a CBD gummy where they used a water-soluble form of CBD and they mixed it in, and the flavors are out of this world amazing. They started out as an alcohol gummy company, like a gummies that taste like your favorite kind of alcohol.
Sure.
And then they moved into the CBD gummy. Sometimes just having a product that you actually enjoy, that is palatable, can make that taking the medicine even that much more pleasant of an experience. So I just thought I would throw that out there.
Absolutely.
What else do we have, Erica?
We have a beautiful cornucopia over here. It all depends on where we want to go with this. Let's see. So,
I found somebody was commenting also, tinctures are less they wish tinctures were less costly. Yeah, they can be pretty darn expensive. They're still expensive in many of East Coast adult use states. I've had luck making my own CBD tinctures. May have to do the same with THC. I think that making your own can be really good because you know what's going in them, but dosing becomes a little bit of an issue, right? It's with the manufactured products, they're getting better and better at coming up with formulations and forms that can make it easier to dose. And then tinctures are easier to dose than vaping or smoking. And tablets, sublingual strips, a lot of those other even more manufactured products can help with dosing as well. What do you recommend in terms of the cost for people? I mean, what do you think is a good affordable version of this?
Yeah, so when it comes to tinctures, they are expensive. If you consider with industrial hemp, how much hemp has to be processed to make small amounts of CBD products is part of the problem, along with if you're using CO2 processing, it's not a cheap process by any means. And if you're talking just the extraction itself, it's the whole process can be expensive, and then you add in the testing and it's really adding up. One thing that I find sometimes happens a little bit too much is that that people are told to dose sometimes higher than they need to, and that if one way is to, you know, whatever product that you end up buying, really starting at a low dose, and so that you're using the least amount that is effective for the condition that you're treating. And so sometimes we might be taking too much. I know with the products that we have, we actually use a higher dosage of, meaning it's like we have a 750 or 1500. The idea behind that, though, was not to have this, that you're taking so much CBD, but that you could actually dose small, and that one bottle could actually last you quite a while.
So 750 or 1,000 milligrams per bottle.
Per bottle, yes.
Got it.
So like our 1 ml of the 750 is 25 milligrams, 1 ml of the 1500s 50 milligrams. But if you dose it slowly and don't start with the full ml, you know, you might start with a fourth or a half, and that one bottle isn't going to last a month. It's going to last 2 months, or depending, it might last 3 or 4 months, depending on how you're using and what you need to do. So be careful with your dosing. You know, you might be able to stretch it out quite a bit further.
And that might be relevant to the comment that Lizette has. She said, I can't seem to find a happy medium. I can't get to sleep or stay asleep long enough, so I'm exhausted all the time. I've tried soaking, vaping, edibles, sublingual. Hate the high feeling and the heaviness afterwards. You know, everybody is so different. It is really, really hard to say, here's your magic formula. One of the things that I found was when I was trying different forms, THC tinctures, which people don't talk about as often as they talk about the CBD tincture, but THC tinctures are sort of a middle ground. I found them to be quite effective. Just some drops, you know, not even a full drop or full. I'll definitely start with even
1/4 or less.
Yeah, and then work away. But it can be, and then holding it under the tongue is a very different kind of feeling. It is a much sleepier feeling. And then the idea of looking for the CBN products, there are sublingual strips and tabs now, dissolvable tabs with CBN. The more people are manufacturing these different types of products, different forms, I think you'll end up with more options, but there's not any, we can't say what would be perfect for that one person.
Absolutely. Like the one thing I would say, if that heaviness feeling, she might actually benefit, if she's going with a heavy indica, she might actually go more for a hybrid. And so even though we say, oh, you take indica for bedtime and it makes you sleepy, some people describe that as, what is a couch lock? And I had one patient describe it as coffin lock. Like she hated that feeling. And I never get that image out of my mind of just hating that heaviness. And so really kind of pushing more to a hybrid. So you're getting a little bit of that sleepy feeling, but you don't get that heaviness that might be occurring with that as well.
That is such a good point. And again, every state that you're in, depending on how they cultivate the cannabis, there's going to be so many variations. That's why it's really hard, like you said, these days to say, here's the strain.
Right.
Because one person's OG Kush is very different from another person's.
Absolutely.
So it does take a little bit of experimentation, which is hard for us when we're so used to just pulling something off the counter or getting a prescription and it's supposed to work exactly like it says.
Right. And everything's uniform. Absolutely.
Right. And plant medicine is not exactly like that.
But it's customizable. And so, and it empowers the patient, which is really a big focus of what I like to do. So,
yeah, I think that's incredible. All right. Well, we've covered a lot of ground here. We're getting to the top of the hour. I have a couple of more slides left. We can keep our video on. I'm just going to pull them up and we're going to close for now. Let's see. Let me share the screen again. I'll be right back at you. Okay. That was a great Q&A session. I just wanted to remind everybody that if you've registered, you will be getting a recording. It takes us a little longer these days. I'm sure you are all feeling this sort of frozen time where you're not as productive as you want to be. So in about a week, possibly 2, you will get this video. We also do a little bit of editing to clean it up on either end. We don't edit the good stuff in the middle, of course. So be looking out for this in about a week or 2 in your email inbox. And also Dr. Bridget had mentioned off the air that she wanted to give you a special offer for her line of products, CBD products. So that will be in the email as well. So we'll make sure that you'll get that. In the meanwhile, another woman-owned CBD company, some very lovely CBD tinctures, is Juna at junaworld.com, and she's offering 15% off your first order if you use Ellementa. So you may want to check that out, or you can wait a week or so and we'll have Dr. Bridget's offer to you. You can find us in groups. We have some state specific, and we also have a Canada group on Facebook, but you can see the listing at ellementa.com/groups. Our gatherings right now, all entirely online, ellementa.com/gatherings or ellementa.com/events. You'll see the same lists. And then we're on Instagram, Facebook, Twitter. We're also on Pinterest. We're not using Pinterest as much. Now, where can we find you, Dr. Bridget?
Yes, so my website is greenharvest.health. And so you can find more about us and you'll also find our CBD products there as well. And we are active on Facebook and Instagram and Twitter and whatever else is out there.
And all the crazy places.
And all the crazy social media places. We tend to stay active and love communicating with our patients and answering questions. We operate much like a concierge type service. So we often talk quite a bit online to patients and
I was going to ask you that if somebody's not in Columbus, can they still get in touch with you and still get some information from you?
Yes, absolutely. So we will definitely we want to help people, right? And we want to have people feel empowered. So we definitely will have Facebook conversations or emails from people in different states, and have an opportunity to kind of encourage them in their journey. And of course, in Ohio now, we're doing some telemedicine because of all the changes that have been going on. That wasn't there before.
Wow. Okay, good.
But we actually have offices in a couple different cities here in Ohio. So, and we're still doing that. So stop on in, I guess. And, but we're happy to talk to everybody. So.
Excellent. And we've got a couple more things coming up soon. Just want to let you all know that Sunday, the 26th, this coming Sunday, is our Ellementa virtual book club with Alana Frankel, who's going to be talking about women and weed. She also has a pretty compelling story about her traumatic brain injury and how CBD helped. So you definitely want to tune into that. And we love supporting authors. So that's really important for us. Then the following Wednesday, so next Wednesday, is Tara LaRock. She's going to be talking about mindfulness and motherhood. Nothing to do with cannabis or CBD. We do have a lot of wellness topics, and so she will be explaining how mindfulness works with your body and your brain, and how it can especially be helpful in times like these, like we're going through right now. And then on Sunday, May 3rd, is Dr. Swathy, who's going to talk about how to talk to your provider about cannabis, which I think is really helpful. I mean, when you have physicians like Dr. Bridget, like Dr. June Chin, like Dr. Knox, who we've had on before, Jessica Knox, they're obviously very friendly, very accessible, very open. But then we've got some physicians who aren't familiar with cannabis. And so being able to talk to your physician about it is really important. So those are some of our upcoming events. And thank you. Thanks everyone for being here. Dr. Bridget, this was so good. I am glad. How did we get connected? Was it
I
social
know.
media? How did we find each other?
I know. I just was thinking that the other day. I was like, how did this start?
Yeah, exactly.
Yeah.
I like I said, I just love it when we have physicians here, naturopaths, people with medical backgrounds. That's not my background, but it is just so enlightening. And I love it when you all have very similar views. That's how I know the information is good. But then you all add something different and new and fresh, which is very invigorating and very empowering for somebody. Uh, we want you to take charge of your health, everybody. We want you to be able to know what questions to ask and where to turn for the right information, the good information. And I hope that you all stay healthy and stay safe. Thank you.
Absolutely. Thank you.